to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, the topic in which we are going to discuss today is men and prostate health. And to discuss on this topic, we have with us Dr. Amlan Jyoti Sarmah, Chief Consultant Urologist from Hayat Hospital. So not to waste any more time, I'll straight away move to Doctor and talk more about the topic which we have taken today. So Doctor, welcome to Good Life, the health show. It's a privilege to have you in our show, and you are here and you will be guiding us on the entire episode about men and prostate health and what are the diseases and what kind of precautions one will be taken. So first of all, the first question I would like to ask you, as you are a urologist, so what is urology, would you like to tell, and what would you like to tell to our viewers of Good Life?
So actually urology is an established branch of surgical diseases. I mean, it comprises treatment of kidneys, urinary bladder, prostate and genitalia. It's basically today we will discuss on men health and prostate diseases. So prostate is an normal organ that located in the genital tract, that present in all male. It's the size of almond, the size of almond. So around 20 to 22 grams normal size. So it help in the reproductive age group around 25 to 45 years of age with the reproductions. It helps with secrete some hormones and secretions. So after the age, it start giving problem to the patient.
Okay. So what are the normal functions, as you have already mentioned? So what kind of diseases one suffers if there is any problem? So what would you like to tell on that?
See, actually prostate disease is very frequent. It's very commonly seen, but people are unaware of these diseases. Very frequently, its infection is occurred to the prostate gland.
Okay, and how does that occur?
Yeah, it usually occurs from urinary tract infection. Urine infection, it can ascend into the prostate gland, and sometimes it can go from the blood also. Suppose patient is having other diseases, that's diabetes, patient is having other comorbidity condition, like patient is in ICU, patient is having other diseases, cardiac disease. So these are the risk factor patient may go for infection of the prostate gland. So it is known as prostatitis. So usually most commonly it is acute prostatitis that is seen in hospital setup, that suddenly patient develop these symptoms of fever, difficulty in passing urine, and there may be burning in the urine, and patient will have high grade fever like that. That is acute or sudden episode of prostatitis. But in a chronic prostatitis, the patient will not have that much of symptoms. Patient will have a subtle type of symptoms like that, just casual burning in the passing urine, while passing urine, has to go repeatedly to bathroom so that he has to pass urine. Sometimes there may be high color urine, there may be turbid urine also, milky urine like that, sometime on and off. So these are the symptoms of after passing urine, he may have a sensation of again we have to go for passing urine like that, so incomplete sensation of passing urine like that. These are the common symptoms in chronic prostatitis. So these are occurs at any age group. It can be any age group. This infection can occur at any age group, starting from 25 to 45, maybe 55, 65. So this is the most common illness, the prostatitis. The second is a benign enlargement of the prostate. As I have already told you, the normal size of the prostate is around 20 gram. So in benign enlargement of prostate, the size of the gland increases. From it can increase up to 50 gram, 150 gram, 200 gram, up to 250 gram. We have seen cases. So once it enlarges in size, it is not cancer. It is benign. That is, it has not cancer component, but it enlarges, just like hypertrophy of the muscle. Once you the size of the muscle increases, as you have seen. So that is an increase in the size of the gland size. So it start causing problem.
So one doesn't have to worry, because like if suppose these things happen and these kind of symptoms happen, some might be having confusion in their minds, that they can come and see a doctor and they can come and see a urologist, isn't it?
Yeah, obviously. So it is not like that the enlargement of prostate you have to go for some surgery in every time, you have to go
that kind of notion is in everybody's mind
actually. Like that. It is not like that. Because it is very common to see. It's at least in the 6% of the all male around the world is at any point of his life or their life, you will suffer from this problem, BEP, that is known as benign enlargement of the prostate. So nothing to worry about that. It is not cancer. So third common disease is cancer prostate, that is carcinoma prostate. So it usually occur after the age of 55. and commonly seen after the age of 60. So, in the cancer will also give the similar type of picture, the similar type of symptoms patient will have, but the disease is aggressive. So, we have to treat it like, we have to evaluate it like as a cancer disease.
Okay. So, suppose as you have mentioned about the symptoms, the basic symptoms is very basic because the fever which you mentioned, and if suppose someone is having a sensation while urinating or something like that. So, one gets a fear, and if frequently they are using the loo, so they might be thinking that they might have diabetes, isn't it? That question might come in their mind. So, in that case of time, one should actually consult a doctor, isn't it?
Yeah. So, actually this when the disease are very early stage, the symptoms are very low. So, you have to be, the patient has to be very careful, because the symptoms are like repeatedly going for bathroom, and then there may be in the night time he has to go for toilet every now and then.
Right.
The flow of urine is coming down. Sometimes there may be blood in the urine also, but that is in advanced stage. That is when the disease is advanced. In cancer diseases, patient sometimes present with back pain, and sometimes other advanced condition like constipation, like that. So, we should not, the patient should not wait till that type of symptoms.
Okay.
So, before that he is having some initial stage, he has to go for some, at least for medical consultation.
At least for medical consultant, and really, and you will be there, and other doctors will be there to consult them and give a proper diagnosis about the matter, whatever maybe they are not facing with the problem which they are thinking, maybe something will be other, but at least they can have a proper checkup, isn't it?
Definitely.
And what kind of precautionary measure one should take up?
See, actually, for just first is a lifestyle modification. See, this is as we have already discussed, this is a lifestyle disease. So, as the age will progress, everyone has to suffer from this type of disease, benign enlargement of prostate. So, first we have to take, as such there is no dietary restriction for this type of disease, but it has been seen in some studies like that, if you decrease the amount of fat intake in the diet, and red meat intake in the diet, in that case there is a less risk of carcinoma of prostate. Prostate cancer risk is less reduced. The second is a risk factor is if there is any history of family history of disease like carcinoma in father is having carcinoma prostate, cancer prostate, or in the same family somebody is suffering from, or somebody has already suffered from that type of disease.
Okay, so it is hereditary also?
Yes, it is hereditary. It is very much hereditary, up to 20% increase in the risk.
Okay.
Yeah, if the parent that is father is suffered from, then the son is having 20% increased risk of having carcinoma prostate.
Okay.
So, in that case there is actually screening in the US or in the developed country, there is it is a most common cancer in male.
Okay.
This carcinoma prostate is the most common cancer. So, in US there is a system of cancer prostate screening system. There is only two tests. One is a blood test, one single test, and that is PSA test, and the second one is a examination by the urologist. These are every individual has to go after age of 50 years every yearly for up to the age of 60 years.
Okay.
That is mandatory in some areas.
Okay. So, and doctor, this is a topic like people don't talk frequently and they feel shy or they feel hesitations are there in among the people to talk freely with their family members as well. So, on that note, what would you like to tell the viewers out there?
Actually, as these symptoms are not very frank symptoms, and these are not very easy expressing actually also, because to the parents also, or to the child or somebody like that, because elderly patient, they just used to just this is a aging process, just accept that like only. So,
but at least one should not ignore, because it might create a worse situation kind of thing as well.
Yes, if it is detected early, then we can cure this disease. It is not like that, even if it is cancer, it is one of the cancer that can be cured of the disease.
Okay. Okay.
The prognosis is very good if it can be diagnosed at an early stage. So, once if you feel like somebody is feeling like this type of symptoms, then you can go to talk to a doctor, then he will evaluate, then next step can be done.
At least they can talk to their close ones whom they are free to talk to. Not to everyone, but at least to the close ones, and one can come and every time see a doctor, and doctors are there to help them out and diagnose everything, whatever possible ways done. And you also give them a consultation. A proper consultation is very necessary nowadays to the patients, whoever come to you, because in their mind there are several questions which come to their mind at what has happened and what kind of disease is this, because several diseases are these days prevalent in every passing time. So, on that note, what kind of consultation do you give to the patients out there when they come to you? a proper study of their mind, what they want?
See, initial cancer is something different. You have to be in treatment. You have to be aggressive. Okay.
Right.
So, but that was I am telling that in benign enlargement of the prostate. So it is lifestyle disease. If you change your lifestyle, like decrease your smoking, taking water, decrease the water intake in the night, evening time, so that you don't have to wake up in the night every now and then, decrease your smoking habit and like that, taking reduce your alcohol like that. These are the basic primary advice we usually give. So up to 30 to 40% improve with this only. Okay, these symptoms, it is a bothersome symptoms. Now he has to go for repeatedly to passing urine like that. So this is the first. Second, will give the assurance that nothing to worry. It is not life threatening. Okay, only unless and until it is he is unable to pass urine. So he completely sometimes has there are some patients they are unable to pass urine. In that case, we have to go for some intervention. We have different intervention. We have to go for in that cases only. Otherwise, we can treat with lifestyle modification. We can give some medicines also. Sometimes he patient might have to take for long, but there is definitely lots of options.
True. And of course the technologies are advancing and many kind of new technologies have come up to treat all kind of diseases. Is there any kind of technology you would like to talk to the viewers out there? What kind of technologies you are using to treat these diseases?
See, this recently we have introduced a 200-watt thulium laser.
Okay.
So this is actually in the trend in the treatment of benign enlargement of the prostate. This laser surgery for the prostate we required in those cases which are not managed by the medication, lifestyle modification, and very refractory cases.
Okay.
So the advantage of this laser surgery is that these risks are very less.
Okay.
Patient can be sometimes can be discharged in the same day after the procedure, can be even after next day. There are less risks of bleeding and other complications of surgery.
Okay.
And this is a recently actually this is a very sophisticated instrument. So we have done lots of cases and patients are very happy with that.
Okay.
Okay, because even after doing the surgery, patient is able to pass urine normally. His life is going for a normal.
Okay, so they are benefited.
Yeah,
actually.
yeah, they have benefited. So this is the thulium laser that is very much helpful. Even in those cases, patient because see these are elderly patients are most common.
Very true.
60, 65, even after 80 years also, we have operated with this laser. So in that group of patients usually have other comorbid conditions like heart disease, lung conditions are bad, diabetes and other conditions are there. So in that cases also with the laser surgery we can go for that.
Okay.
We go for surgery without having any much risks and complications.
Okay, okay. And doctor, how does diet play an important role in creating these kind of diseases? Is there a proper diet chart for these kind of patients whenever they come to you and a proper diagnosis or a proper treatment is done, and after that what kind of suggestions do you give to them?
See, actually there is no direct relation of diet for this cancer, prostate or benign enlargement of the prostate, but there are some studies that has been seen that the fruits, lycopene, that's in tomato we have seen lots of lycopene, and like that. This type of diet usually decreases the incidence of prostate cancer and benign enlargement of the prostate also, and decrease the intake of animal protein and fats, animal fat also, and other omega-3 fatty acids that are rich in fish fat, that is helpful. This is helpful for this type of diseases.
Okay. And if suppose there is a kind of like a patient you have come to and they will need a surgery.
Yeah.
So tell us something about the surgery, how successful it has been in the days to come, and what kind of more advancement is there in this kind of surgeries? See,
initially I have told you that laser surgery is the most advanced we are doing right now. Advanced, there is
which is safe.
It is very safe. Up to the success rate is I can say about 90 to 95% cases usually success.
Okay.
So that patient will go to near normal life after this type of surgery without taking much risks of surgery. So other conventional surgeries were there. We are before this method we are doing that. So but with that we have some limitation. But now with this laser, thulium laser, so all these risks are less enough. Okay. So patient need not to worry for that surgery if required even. So we can go for this type of surgery, thulium laser. Okay. And I think it is right now it's the best laser for prostate surgery.
At the initial stage when a patient comes to you, what is the first procedure you go with the patient? Proper diagnosis is very important. Yeah. So what kind of like under observation things are done? What kind of like paperworks are done? So what are the main procedures you do with the patient?
The first we'll do take a history. History is very important, proper history. See, the symptoms are very important. because sometimes it might not be necessary for going for any investigation also, because patients see if today we are discussing something, tomorrow some patient might think I am suffering from this type of disease. So I will ask the question, a few one or two leading question will give them a clue. He is not suffering from any major illness. We don't have to go.
It's actually everything in our mind.
Yeah, that's right. So first we'll just take a history. We can just segregate the patient. Yes, he needs some further investigation. He need not nothing to be. Or just I'll give some reassurance. We'll do some basic investigation, blood or urine test. Our clinical examination is very much important. We can see the patient, we can examine the patient, then we'll just evaluate the patient. Then if required, we'll go for the further test.
Okay.
Test comprises of blood test, ultrasound of the abdomen and other rest of the examinations. So after that, this test we can come to the diagnosis. Yes, he is suffering from this type of disease or he is suffering from this type of disease.
Then the treatment starts.
Yeah, after that treatment starts.
Okay.
In most of the cases is only, I have already told you, it's a lifestyle modification and medication, and very few of them will require surgery, that too with a laser surgery, which is very safe and very effective, and patient can go for directly without any having complication.
Okay. So Dr. May, there must be some patient who have come to you and you must be like very much happy with the treatment done by them, and they are also very happy with the treatment taken by you. So any kind of incident you would like to share to the viewers of Our Good Life today, and you must be very happy while treating, because when your job is done, when your job is successful, you feel very happy, isn't it?
Yeah.
So is there any kind of like incident you want to share with us today?
See, actually there are many cases I can remember. See, one patient was a very elderly patient. He was 88 years old.
Okay.
So he is having cardiac problem. He has already angioplasty was done. So he is taking many medicines. So he is on catheter for last 1.5 years.
Okay.
So there is a pipe that is for passing urine. So he can't pass urine for last 1.5 years. So he has been refused for operation because he need operation for this enlarged prostate. He has been refused for surgery for many hospitals. He has even here and there also. Because he is a very high risk patient, you can operate in that.
Of course, you have to be very
careful.
careful.
Very careful in that case. So we have operated with this thulium laser. He has been successfully operated, and he is now passing urine normally, and he is happily living with his normal life. So I am very happy because he is a very actually 88 years old, but otherwise he is it's okay. He can work, he can talk. So that's a very pleasant for me actually. Indeed. There are many incidents are there, but that is the one I can remember right now.
And the introduction of the new technology was also successful, and people have got to know that people do need not to worry, because they can come up and they can have their proper diagnosis and proper treatment can be done at any point in time, isn't it?
Yes,
so on last note, what would you like to tell to the viewers of Good Life, the health show, and what suggestions you would like to tell them to how to take care of themselves?
So first, I'd like to tell all the viewers like that. The symptoms of urinary symptoms like passing urine repeatedly, decreased flow in the night, you have to go for bathroom repeatedly, there's sometimes burning. These are all frequently everyone suffer from this type of disease. So you should not ignore this type of disease and this type of symptoms. So if you are suppose suffering from a long time, maybe around months or like days, then you should see a doctor as soon as possible. And nothing to worry for that also, because everybody never requires surgery. Okay, in many of the cases we can treat with lifestyle modification, and then secondly we can treat with medicine very well. In some cases we have to go for surgery. That too we have the advanced laser surgery, which is very safe, very effective, and patient can lead a normal life.
Right. And these things, everything can be done only if the patient comes to you and have a proper diagnosis, and every confusion, whatever they have in their mind, can be cleared out. Maybe they are not suffering from the disease they are thinking about, isn't it? And that clearance can be given by only you as well as the other doctors who are there. And I would like to tell the viewers of Good Life, the health show, we are joined by Amlan Jyoti Sarmah, who is here and giving us details regarding the prostate gland and also telling us about the diseases. And one need not have to worry, because if you find some of the symptoms which we are discussing right now, if you find some of the symptoms, you can every time go and see a urologist and find out what kind of diagnosis can be done and what kind of treatment is necessary for you. And maybe not, you don't need a treatment and can be cured by any of the medicines which will be prescribed by the doctor out there. So thank you, doctor, for coming to our show. It was a privilege to have you in a discussion, a clear-cut discussion, and I'm sure the viewers now will not hesitate and talk to their doctors freely and talk to the near and dear ones who are you close to, and you can talk to them anytime, any moment, and doctors are there to help you out. On that note, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja. Well, now it's time to move on to a subject which plays a very crucial role in our lives. In order for our bodies to function properly and stay healthy, it is very important that we follow a good nutritious diet. And today the topic which we have taken is child obesity. And to discuss on the topic, we have with us our nutrition expert, Tina Baby Borwa, who will enlighten us on a proper food habits for children. So Tina, once again, welcome to Good Life, the health show, and you are here to tell us about and tell the parents out there about the child obesity and how to take care of their children. So first of all, what causes child obesity, children obesity?
Nowadays, it's becoming a very, very burning, in the society. Among the 10 children, you can find it out like 5 of them are overweight or they are suffering from obesity. It is because of the lifestyle. It is having some factors, environmental factors, you can say, in which environment they are been growing up. Media is another very, playing a very crucial role in this aspect of obesity, and the type of food they are consuming in their day-to-day life. So these are the certain factors basically we have seen in promoting the childhood obesity. So coming to the parents, like which type of food they are providing the children, whether it is like healthy for them or whether it is not healthy for them, the choices of making a healthy and unhealthy food, making the children from the very beginning of their life, it is very, very important.
Because parents are playing an important role in the diet chart of their children at home, isn't it?
Yes. And consuming lots of sugary food items, and having nowadays those colorful, you can, whenever you go for a shopping mall or a supermarket, you can see full of like some chocolates, which are packed with lots of sugars, and like some of the juices which are packet sugary, you can say sugary packet juices with artificial colors. So there are minimum amount of fruit juices added on it, but it is being sold out as a fruit juice. So children are becoming more prompt of having those kind of food items.
They're more attracted to those kind of packet and colorful items.
Right. And as I said, media is also a very playing a very crucial role in this aspect, because in advertisement they are being showing certain kinds of toys are being given as a gift if you purchase certain junk foods, a packet chips or maybe some of the packet noodles. But as a parents, it is very important that if a child is consuming such kind of packet items, that how much the portion size is very, very important. If a child is completely having 3-4 packets in a day, he or she may become habituated of taking such kind of packet food items, and the homemade food which is a balance maybe at home, that those things will be left out, because if you do too much of snackings, obviously you will not feel like eating the basic food.
And this is a big task these days for the parents out there, to take care of their children and to tell them not to have those packet items, isn't it? Because children are more prone to those items. So what can a parent, and what is the role of the parents to tell their children that you should not go for these kind of foods and you should go for these kind of foods? So what are their role and what they can do to tell their children not to go for those kind of foods?
Actually, you cannot stop the children from having such kind of packet food items. Practically, if you see it. Now, if I tell that completely you stop having those kind of packet food items, then it will not be practical enough. So the portioning is very, very important. In a day, how much the child is consuming, that has to be noted, and do not make your child completely dependent on such kind of food items, and do not make it addicted. Some of the children coming to me, I have seen that they are addicted to certain kind of food items. If they take sandwich, then morning to day and night they keep on taking sandwiches because they like the food. That's why the parents also keep providing it. So do not make your child to habituate of having only single type of food items.
Right.
Keep variety. I say in my all episode that always variety is important in kinds of like children food items, because every food items have its own specific nutritional value. Now if fruits have certain nutritional value, like it is rich in vitamins, it is rich in minerals. Some other legumes and pulses are again rich in protein. Cereals are again rich in carbs, so they provide energy to us. So every food items plays a important role in our day-to-day life. So the parent should completely module in such a way so that the children may get a balanced nutrition, and they should cut down the snacking before the major meals.
Okay,
this is very important, because they if they are keep snacking all the time, obviously they will not feel hungry and they will not eat properly. And another thing is that overeating. Yeah, that is also very important, because out of pamperedness, out of love, if you keep pushing the child, eating too much of foods, that also lead to obesity.
Right.
So this is also a factor.
Because the parents feel that, oh, my child is having good time of food and good quantity of food, so I am so very happy. But that is leading to obesity, isn't it?
Yeah.
Okay.
The quantity as per
proper quantity is very important.
Proper quantity is very important as per the weight, as per the age, and as per the height of the children. So we recommend that from 2 to at least 2 to 10 years of children should gain 2 to 3 kgs of weight gain should be there in a year. If it is more than that, then the children may be having certain kind of disease. Okay, like due to some medical problems also, nowadays the children are having obesity. There may be thyroid problem, there may be some other kind of hormonal.
So that is something else actually. That is not related to the diet or diet plan which they are having. Maybe that is something, another medical reasons. But the diet reasons.
Medical reasons are also correlated with the food.
Okay.
Because if a child is having thyroid problem or any kind of like hormone related problems, so there may be certain kind of weight gain. Now in that aspect, if the child is having too much of oily foods, too much of calorie dense food, the obviously there will be a little bit of weight gain, and on the top of that, if you take too much of calorie dense food, the weight gain will be more in that aspect. So that is to be checked out by the parents. They should go for proper counseling through a proper medical practitioner, and going to a nutritionist, formulating the diet. It should not be that at home you have thought something and you have gone through some internet papers and then you have cut down everything of your children. Then again it will lead to there may be some barrier in your promoting the growth of the children. That also has to be marked. If your child is obese, then you have to cut down the calorie dense food, the fatty foods which they are maybe taking in a regular manner. Snacking should be in a healthy way, but you should not cut down the nutrients that is required in day-to-day life. Maybe I have seen some parents, my child is gaining weight, that's why I have cut down fish, I have cut down egg.
So that shouldn't be done.
That should not be, because they require those things.
Of course.
Of their that is a growing stage, they need it because of their proper growth and development. But the excess of the amount that they are consuming, maybe they are taking a full bowl of popcorn, if they are taking a big burger filled with lots of cheese, or maybe filled with lots of creams, and if they are taking 2-3 numbers of ice cream in a day, those things has to be cut down.
Okay, so the quantity and the proper timing of food is also very important, isn't it? And how does a parent will come to know that her children is suffering from obese? Is there any kind of like symptom, or is it the necessary that the size, or what is more prevalent, and what kind of like symptoms one should come to know?
you should go for a regular health checkup at least in a year.
That is the thing which every parent ignores, unless and until something happened to the children, and then only they'll see a doctor, isn't it?
Right.
So, but apart from that, what can a parent do, and what can a parent come to know?
Yeah, at least you should check the weight of the children 6 months, in every 6 months, and you should like correlate with their height. If it is more than as per the height and weight, if it is not coming accurate, and if there is a deposition of the fat deposition, excess fat deposition in the body, then you should go and see a doctor first, and then you should be followed to a nutritionist or a dietitian that to module up the entire plan. Why? First thing is that why the child is obese. There may be certain factors, maybe there may be some hormonal factors, as I told. The child may be having some genetic factors, maybe from father mother side it has been carried out.
First we have to find the reason and then we have to work on it.
And there may be some, your school also plays a very vital role with whom you are like together, how they are consuming the food, because what you are carrying in the tiffin, should your other schoolmates may be carrying something different, that also influence a lot. The atmosphere, as I said, the environmental factor. So it is also very important. So those things has to be finded out, that why the child is not having proper growth and development, and if the child is having weight is more as per the height, as per the age, then the reason has to be finded out first. Suddenly you should not cut down everything. Then again there will be a nutritional deficiencies. Then there may be some other, again, some other problems may come up. And also obesity nowadays we have seen is correlated with some of other problems, like if the child is obese, if the parents are ignoring it, because they are like finding it more bubbly, looks very
the love
cute.
and affection comes more, and they have to take care of their health. That is more important.
That is more important, because that may again increasing in the weight may lead to some other chronic problems like diabetes, cardiovascular diseases,
which is nowadays seen in children as well.
Yeah, right. And maybe some pulmonary, diseases, maybe some, kidney disorders. Those things are also correlated with the obesity. One child coming to me is its height is 156, somewhat like that, and the weight is 89 kg. He is of 8 years.
Oh my God! 89 kgs.
89 kgs of 8 years. So at the very beginning the parents may have ignored, because when I have taken the history of the child, so they said that he is been gaining weight since from 3 years of their of the age, but they have ignored it,
because that time they found him to be cute, very bubbly and all.
Those things. But now the child as keep on gaining weight, now reached to the 89 kg, they also find it little bit, the child psychologically and academically is also lowering down. So they found something is wrong. That's why they brought him to the doctor.
Of course, that affects your psychological problem as well, because when you are with the friends and all, they tease you or something, these kind of incidents also take place, for which you are very depressed and you don't like to speak to everyone. So these hampers your psychological problem, isn't it?
Yeah, obesity also, psychologically the children will not be able to grow, because as you have mentioned those things, like they will be teasing you, the good dress will not come to fit you. So those things, as the child keep on, age increases. So with that, when they grow up with an obese body, so those are also come and come and
in the entire area. Actually, you have to be very careful, and this is the part where the parents are playing a major role, isn't it? Parents have to take care of their children whenever they are going out or whenever they are amongst their friends. They have to see what kind of food they are having, and if they are influenced by some of their friends that they are bringing, oh mama, he or she is bringing that kind of tiffin, I should also go for that. But you have to teach them it's not every day good for your health, isn't it?
Right. And
what are the proper food habits one should teach their children?
once you keep on gaining weight, no, the child may become also hypertensive, you know, that as I mentioned, that one example I have cited, then the child has become now hypertensive. You know, another problem has came. Already the child has some hormonal disorder, because of that he has gained so much of weight, and now he is like hypertensive. You know, so if the child start gaining weight, then and there you should go and see a medical practitioner, so that the correct things may come up in a correct way.
Correct time.
Yeah, at a correct time. Yeah, this is very important.
Very important, because it can lead to other diseases as well, as you have already mentioned, isn't it?
Right. So, you know, at home you should teach your children the preferences, you know, what type of food you are providing, and parents and pair mates, no, plays a very a module to them. If in front of the children, if you keep on munching some of the junk foods, obviously they will be more you know, prompt of having such kind of junk foods and all. So always try to have such kind of food items which are homemade, okay, and which is full of nutrients. Instead of providing them those packet full of colored juices, instead of that you can make some of the you know, smoothies and some of the fresh fruit juice you can extract at home and provide your children. And the tiffin should, as I have mentioned, the tiffin should also plays a very important role. So the school authority should also take up, if they are bringing up too much of junk foods and all in the tiffin, that should be cut off, and try to have some homemade snacks or homemade food items.
And nowadays schools have also taken up initiative, as I have already heard from someone, that they have made a diet chart for each day, and they have sent it to their parents to send their children with these kind of food. Maybe they are also taking up initiatives to have a proper diet for the children who are studying in their school, isn't it? And these are the things, like not only the parents, but also have the society should also, and also the schools and the places where the children are going, suppose of the any other institutions also, they should also take up this matter, because this is a very important issue, child obesity, which is seen nowadays in every children because of the diet thing, and which because of the food habits one has taken up and one has made habits in these kind of, isn't it?
Right.
So Tina, on last note, what you would like to tell the viewers, and how to tell the parents and to tell their children to take care of their health?
We are more concerned of the deficiencies, you know, all everywhere, like, you know, this deficiency, that deficiency. But again, on the other note, if you see on the other side of it, that, like, you know, children are also suffering from obesity. So you know, in case of obesity, it is very important that proper timing of the food should be fixed at home, and then what type of food you are moduling for your children, this is very important. Junk food should be cut off. I will not say that you should completely stop it, but the right food choice you should teach your children to have, because life begins from the children, and slowly it will lead to the adulthood, and they will be carrying out their habit, you know, in a long run of their life. So it is very important that what you teach your children today, tomorrow they are going to lead that only. So it is very important to have the preferences at your home. The healthy snacks should be prepared at home, like you can prepare some healthy burger or healthy sandwiches, healthy rolls at home, instead of, like, you know, going for some snack food items. And you should not overdose your children, I will say overdose, because you should see the portioning is very much important. How much the hunger it is, let them
quantity
take that
matters.
much. Yeah, quantity matters. Let them have that only. Instead of you know, the child may be hungry, that maybe thing should not come. That's why by overdosing them, do not lead the child to be overweight.
Because everybody loves their children, so that love should be controlled. I mean that you have to have the proper quantity, and a proper timing should be maintained in your children. So thank you, Tina, for coming to our show, and you were enlightening us, and you were telling, I'm sure, the viewers of Good Life, the health show, who are listening now, and the parents especially, especially who are listening now about child obesity, the discussion we are doing and we have done just now with Tina. And Tina, you have clearly mentioned that how to take care of their children and what kind of diet they can include and colorful items they can prepare at their home itself, and so that people, the children who are attracted to the outside food, they can be attracted to the food at home prepared itself, isn't it? So thank you, Tina, once again to coming to our show and enlightening us on the important topic which we have taken today, child obesity. Well, viewers, on that note, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja. Well, viewers, urology is a highly competitive surgical subspecialty which focuses on surgical and medical diseases of male and female urinary tract system and male reproductive organs. So today we will take you to the Hayat Hospital that provides the best care with the most developed technologies. Let's have a look at what the hospital has to offer.
Urology today is practically unrecognizable. However, technologically developments are happening every day to tackle with the increasing urological problems in the region. In this regard, we have already showed in our earlier episodes how Hayat Hospital, as a center for excellence, provides the best care with the most developed technologies like laser and endurology instruments to treat diseases related to kidney, urinary bladder, prostate gland and others.
So viewers, today here we are at Hayat Super Speciality Hospital. The hospital, which is known for the quality of treatment it is providing to the people of the region. But today here we are to see what, as a super specialty hospital, Hayat has for the common people of the region. Let's see what's up there.
At the time when people are increasingly booming vulnerable to diseases, the number of patients with urological problems has also been increasing. So, Hayat Super Speciality Hospital has now also introduced a 200-watt thulium laser machine recently for patients with problems in the prostate gland, which can operate on any size of prostate gland with less blood loss under local anesthesia and results in speedy recovery.
This is the new 200-watt thulium laser machine that we have installed right now, a few days back. Basically, this is a solid-state laser machine. This is a new advanced technology. It's the first installation of high-power 200-watt laser machine in Northeast India. So this is basically used for prostate surgeries. Okay, so now we should know what is the prostate actually.
Yeah, exactly.
This is a normal gland present in a male from the birth, but it starts producing disease after 40 years of age. The size of the gland enlarges. So when the gland size enlarges, then we have to go for surgery sometime in unselected cases. So we have just procured this instrument, and this is another part of armamentarium we have in the urology.
This machine, which is the first of its kind in Eastern India and the fifth in India, will also be able to treat patients with heart problems, and those undertaking blood thinner medicine can also be operated through this laser machine. Professor Sarmah described the machine as a boon to the healthcare sector of the entire region, adding it would bring a new revolution to the Department of Urology.
What kind of diseases can the machine treat? Like which diseases can we count regarding this machine?
Basically, this is a specific laser for mainly prostate disease and bladder tumor, but we are more concentrating on prostate, enlarged prostate. Okay, that is the 90% works we do with this is enlarged prostate. This is not cancerous. Okay, in 80% cases, there are enlarged prostate is non-cancerous. It is not related to cancer. But the size of the gland enlarges, so it causes blockage of the urine flow. So in those cases, we can use these machines to increase the recovery rate, faster recovery rate and the lesser complications and the better patient compliance.
What is the USP of this machine? Like this is the first time in the entire Northeast region, and as I have known, it is the fifth in the whole country. So what is the most benefits of this machine? How can the patients, the common people, get the benefits of this machine?
So there is actually no limitation of doing surgery with this machine. There are previous generation machines.
So we can do multiple surgeries, we can say?
No, that's not that. With all the risk factors.
Okay.
The patient, suppose most of the patients with the prostate disease will be elderly patient, more than 70 years or 80 years like that. So they had other comorbidities like lung disease, heart disease and other blood disease also. So with other energy sources, we can't do in those cases.
Okay.
So with this machine, we can do all cases, and there is no, as such, no contraindication of doing surgery with this machine.
Okay.
So we can just bypass all the disease associated with that. We can bypass. There is no comorbidities associated with that.
Being a super speciality hospital, Hayat, in order to bring the common people close to the facilities of the features of super speciality hospital, is providing special discounts to the common people under different schemes.
We are with Dr. Reyes, who is the medical superintendent of Hayat Super Speciality Hospital. So doctor, as a super speciality hospital, what does Hayat has to offer to the common people of the region?
So as we are a super specialty center, we have some social responsibility also. So for that we have chosen decided to choose some organization or community or some form of like a group of people. So for example, we have Guru Dakshina for the teacher community, where we used to give discount from 5 to 30% from like OPD. There is a rebate in investigation. If they are hospitalized, we are going to give some discount in the bed rent. As for the police people, we have such type of scheme where we are like used to give discount to the police personnel along with their family also. Same, we have one neighborhood scheme, the 5-kilometer circle of this hospital residing within the 5-kilometer. For them we have a neighborhood scheme. We have a scheme for the media people, a scheme for the pharma industry. Like you will be surprised that those people are working in the pharma industry, means they used to be every day they are in touch with the doctors or hospital, but if something happened to them, so there is nobody is there. They have been treated like ordinary people. So for them also we have some schemes. They should get privilege. So this is the initiative where we can go to the mass level of the people.
So viewers, that was Hayat Super Speciality Hospital, which has launched the Northeast's first of its kind thulium laser machine, and also has several other facilities for the common people of the region. With video journalist Madhav and Binay, Preeti Priyadarshini for Northeast Live.
All right, with this we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. In our next episode, we will be discussing on some other important health issues. So if you have any queries, please do let us know by emailing us at goodlifeanylife@gmail.com, and you can also WhatsApp us on our WhatsApp number, which is flashing on your television screens, viewers. Well, till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.